Hi, I'm Dr. Katie Landier, the Senior Centered Physical Therapist, and welcome back. In today's video, I'll be showing you exercises to promote bone health. So the risk of developing osteopenia or osteoporosis, which are conditions associated with decreased bone density, increases with age. And having low bone density can result in a higher risk of fractures, which can significantly impact functional capacity. If you know that you have osteopenia or osteoporosis, make sure you consult with your provider before doing any exercise program. If you're unsure if you have osteopenia or osteoporosis, make sure you ask your provider to get a bone scan done yearly so you can be aware of your bone density and know if you need to work on it. As a physical therapist, I recommend you always are working on bone density. So even if you don't have osteopenia or osteoporosis, these exercises are still for you. For more information on bone health, check out my website, theseniorcenteredpt.com. For these exercises, you'll need weights on the heavier side, a stable surface to push against, and a resistance band. Let's get started. Okay, the first exercise we're gonna start with is our body weight squat. So we're gonna take our feet outside of our shoulder distance, and we're just gonna pretend we're sitting in a chair. So we're gonna hinge back, sit it down, and come back up. So finding that hinge is really, really important when we have osteoporosis or osteopenia, and actually just in general when we're trying to strengthen our bones. So what we don't wanna do is we don't wanna find a round back. So we don't wanna round because that can really put a lot of stress on our vertebrae, and we don't want that if we have any kind of decreased bone density. The other thing we don't wanna do is find a tuck. So a lot of times people squat like this, and they're kind of bringing their booty straight down to their heels. We wanna stick that booty out and then sit down in that chair. So let's do 10 right here. Arms can do whatever is most comfortable. Sometimes having a little counterbalance out here can be nice. And we'll go for 3, 2, and 1. Next, we're gonna do our lunge. So similar to the squat, still working the legs, but adds a little balance component. So kind of tricks our muscles into working a little bit harder and has a little bit of a single leg component, which also helps really build the strength in the legs. So we are gonna take a big step to the side is what I like to say. So if I say a big step back, people tend to stack their feet right in front of each other. And that can be really hard for balance, and we don't want that much of a challenge. So big step to the side, nice and wide there. And I'm gonna go straight down. So both knees bend to 90 and back up. I don't wanna be lunging forward or lunging back. It's really like a single leg squat. So we just go down and up, trying to keep that rib cage over the hips. Nice and stable in the upper body. And we can do 10 with this leg in front, and then we can switch it to that other side. I'm a physical therapist, so I've lost my count, so we're gonna do 3 more. 2, 1, and then we can switch it to that other side. Same thing, big step wide, lowering down and raising up. And you should feel this in both, what I call both butts. So you should feel it in the front of your glute and the back glute here. So making sure both legs are working equally. If you feel one more than the other, it's likely that you're kind of having that lean either forward or back. So try to find straight down. And we'll go for 3, 2, 1, step it in. Oh, shake those legs. And we're gonna move to some arm work next. So next we're gonna do our dumbbell row. So we're gonna grab our dumbbells. And what I like to tell people to do is you wanna experiment with a weight to where you can do 10 reps and it's a challenge. So on a scale from 0 to 10 of difficulty, it's like a 6 or a 7. If it's not challenging enough, we're not gonna gain any strength. If you don't know what that weight is, start low, work your way up. So these are 10-pound weights for me. And once again, I'm gonna find that hinge of my hip. So hinging back, I'm gonna lower the weights, making sure my abdominals are nice and braced, like someone's gonna punch me in the belly, so that I'm supporting my low back there. And then I'm just bringing the weights in and lowering them down with control. Looking at the floor to protect the neck. So you can do double rows like this, or you can do single arm rows, one at a time. And noticing that I'm not rotating. So I'm really keeping everything nice and stable so that my spine is nice and straight. And I'm not putting any extra pressure in places we don't want it. Breathing throughout this exercise too. And you'll find your 10 on each side. I'm gonna do 2 more. And then standing up. So use those abdominals, stand yourself all the way up. And then you can set your weights down to the side and grab your band. So with the deadlift, you can use your same weights that you were just using. I like to use the band, especially if you're new to a deadlift. So with the band, we're just gonna take a step right in the center here, and we'll have those feet kind of shoulder distance apart. And once again, we're gonna use that hinge at the hip. So band is nice and taut, so we have some good tension there. I'm gonna hinge at the hip, so we kind of lose the tension, and then standing up, really focusing on that movement coming from my legs rather than my arms. So I'm not lifting here, I'm using the back body to lift those arms away from the floor. Give myself a little tension in that band. Of course, like I said, you can use actual hand weights for this if you either don't like using the band or you want a little more challenge. But this is a good way to find that movement. Make sure the belly button is kind of pulled up towards the spine, so we're using those abs. And we're also really pushing from the hips to stand up rather than pulling from the back or pulling from the arms. And let's find 3 more. And then carefully step off your band. So you want to release your tension first to avoid smacking yourself in the face, and then take a step off the band. And then we're gonna do our push-up. So we're gonna have a stable surface here to push against. So when you're doing a push-up, the less perpendicular you are to the ground, the harder it is. So let me say that a different way. The more parallel you are to the ground, the harder it is. So if you're new to push-ups, you can start doing push-ups on the wall or a countertop. If you're well-versed in push-ups and you're feeling strong, you can start on your knees on the floor, progress to your knees off the floor. But I'm gonna do countertop push-ups here. So my hands are on the countertop, this nice stable surface. I'm walking out just to where I feel I can support myself. Those abdominals are turned on, so I'm not letting my belly button pop out. And I'm just lowering down and lifting up. I like to keep elbows nice and close to the torso. So think about elbows brushing the rib cage, and that gets a lot of work in the triceps. And that's a muscle group we really, really want to work for a lot of functional movement. So I recommend keeping those elbows nice and close. Make sure you're breathing. So inhale, lower, exhale, push. And we'll find 4 more here. After your last one, walk those feet in. Stand it up nice and tall, and well done. You just completed all these exercises for improving your bone health. I highly recommend you take these exercises and do them every day. Do them to start your day, to get you going, to make you feel nice and strong and help improve your bone density. Remember, you can always check out my website, theseniorcenteredpt.com, for more information on bone health and bone strengthening. Until next time, I'm Dr. Katie Landier, the Senior Centered Physical Therapist. Have the strength to live life to the fullest. Bye-bye.